Hi, hope you're all well. I'm Viv and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. And tonight, myself and Dr. Sunny Dhesi are continuing our journey involving ultrasound in our facial aesthetics work. And this evening we're joined by another specialist from around the world, Dr. Barbara Parda from Poland, of all places. I'll just wait and see where Sunny's got to. He shouldn't be too long. I'll send an invite to Barbara as well. It won't be a second. Yes, we've been doing our lives for about 6 months now, so we've done quite a lot of lives with different people. I'll send an invite to Barbara and to Sunny. It won't be a second. Sorry about this. And we'll hopefully meet quite a few of them at an upcoming conference in a few weeks' time. I've just sent Sunny an invite. Just won't be a second, Barbara. Won't be too long. Let's just see where Sunny's got to. He might be stuck somewhere after Halloween, perhaps. I'll have to see where he's got to. I'll try sending in one more invite. Barbara, won't be a second. There we go. I'll send Sunny another invite. It won't be too long. But yes, Barbara is based in Poland. She's a cosmetic doctor. Hi, Sunny. Should have an invite. Should be able to join without too much problem. Won't be a second before we add you, Barbara. I'll just add Sunny first. It won't be too long. But yes, Barbara, I'll let her explain once she's joined after Sunny. But she's got a lot of experience in aesthetics work, uses ultrasound and has done for a while. And she knows quite a few of the specialists who've joined us over the last few weeks as well. Right. See where Sunny's got to. I'll send you another invite, Sunny. There we go. Should hopefully be able to join up any second. There's always the odd problem now and again with the internet. Right, well that's Sunny. There we go. Taking a bit longer than normal, but once we get started it shouldn't be too bad, hopefully. So, right, where's Sunny gone? There we go. And once he's joined we will add Barbara. Where is it? There we go. How are you doing, Sunny?
I'm good, Viv. Thanks. It was I was requesting, but it wasn't. Nothing was
sending me any. No, for some odd reason. I was sending a few invites, but it wasn't telling me you were joining for some reason. But no matter.
I don't get the invites. All I see is request to join, so I requested, and it doesn't never sends any invites to me. So.
Very odd. We're here now anyway. I'll add Barbara because I think she's been. She's been waiting a little while. You've been okay this week, have you, on today?
Yeah, no, it's been busy. I'll just say a quick hi to Dr. Martina, who's watching, social media sister, who's watching. Hi, Dr. Barbara.
I didn't receive your invites. I just requested a couple of times. So it happens the same to me as to Sunny.
Yes. Yeah.
Same with both of you. I send you both invites and they go missing somewhere in the internet, but we're all here anyway, so it's no problem. Nice to see you, Barbara. We've been chatting for the last few days about different topics to do with ultrasound and aesthetics. What I'll do, I'll let Sunny take over for a little while, and he'll talk a little bit about your background.
Okay.
So I'll let Sunny take over if that's okay, Barbara.
To know each other, so I let Sunny to let me know.
Well, It sounds like you guys have obviously got a march on everyone. So for those people who are watching, Barbara, who obviously don't know you and probably don't know us as well, because probably your followers that are following, just why don't you give a brief introduction about yourself, and then I'll lead in with some questions. So yeah, what just your background, your qualifications, and then I'll ask you a few questions.
My name is Barbara Parda. As we've mentioned, I'm an aesthetic practitioner, a cosmetic doctor. I've been in this area for more than 13 years, but by my background, I'm actually a psychiatrist. Yes. Yeah, you are surprised. As many people who get to know me, but I can convince you that these two fields are getting away very well. They interlap.
Oh, massively.
Actually,
no, you don't need to convince me, but
so
I think
majority of my activities, energy, and time I devote to aesthetic practice, but I still have about maybe 20% of my time dedicated to psychiatry.
Oh wow, okay. And when did you shift from psychiatry through into cosmetic medicine? What was it that sparked your interest in cosmetic medicine, and then how did you shift your focus?
I was observing the developing market of aesthetic medicine. At this time, I work in the psychiatric hospital. And I had a nurse. She was assisting me as a psychiatric nurse, but at the same time, she started to work in the dermatological office, helping doctors with peelings. It was the beginning of 2000 and something. Her name is Danuta. We cooperate now in the aesthetic field. And Danuta, she was performing a lot of peelings because it was the time the only peelings were on the market. And when she was coming to the hospital, we ran some activities. She used to look so well. And she looked much more different than me, than other colleagues. I was always wondering what was going about with these aesthetic peelings. And we got very friendly, and she was pressing me, pushing me to go to this field, to get interested in. So I started very slow, still performing my activities as a psychiatrist, going to courses, observing the market, and it was 2008, I think. I attended the first postgraduate aesthetic school in Warsaw. It wasn't easy to get there. It was a very elite school. You had to wait to get there.
Okay.
And after 3 years, I got my diploma. Of course, I kept on continuous training because, you know, when you go to the school, you learn mainly the theory, but the practice I was getting somewhere else, and I got indulged in it very deeply. So now I work in my own office, and I love to perform the aesthetic medicine. It's a challenge, but
I think you're exactly right. Sure. I think you're exactly right, Dr. Bob. I think the two fields of psychiatry and aesthetics do overlap a lot. I was going to ask you, from my personal opinion, I think that in Poland, the training in cosmetic medicine, and obviously I think what you call non-medical aesthetic practitioners are sort of cosmeticians, or I can't remember the title it is, but do you look at the rest of the world, you look at the UK, for example, do you think Poland has got it right in terms of training in cosmetic medicine? Do you think do you think Poland and the infrastructure and the training establishments, do you think you've got it right a better way in Poland compared to everywhere else?
Nowadays we have many schools which offer trainings, but the training is offered only to medical doctors. I remember when I went for the first time to this American training on facial ultrasound, I was so surprised that the majority of the group were so-called injectors. Even the lady who organized the training, she was the PA. I didn't know what was it about. In our country, the official training, the official aesthetic medicine, can be only in the hands of medical doctors. Even it was 2008, I think, I started the postgraduate aesthetic school, and the school recruited only medical doctors, not even dentists. And nowadays, of course, dentists are on the market as well, but many beauticians, they perform like in your country, they perform beautification, but this is big gray market, and we try to work it out. Many lawyers are involved in regulations, but it takes years and nothing happens actually. But yes, a lot of procedures are done in Warsaw. The market is very developed. I know that our Polish market is very attractive for distributors, for producers of HA, for producers of medical devices, because the market is very wide. But many procedures are in the unofficial hands of beauticians. That's why we have a lot of complications.
Which brings me perfectly, you brought this perfectly onto my next question, Dr. Barbara. So what was it that attracted you to facial ultrasound in aesthetics? And the second question, which I can rephrase again, is, how has it changed your work and the view of your patients? So what first got you interested, and how has it changed how you work?
I've never thought that I would be in this field of ultrasound, of course, I was a couple of times a patient undergoing the ultrasound, and but not facial one, and I was filled with the cliche that the ultrasonography, this is a mean man sitting in a very dark room, not very with a poor interactive skills, not talkative. You go into the office, you hand the referral from the doctor, the radiologist doesn't speak with you, you lie down, you get this funny black pictures and you don't understand anything, and you go back to your specialist. And I thought I would never do such a strange, boring job. But I'm a mature doctor. And I was, since I started this aesthetic procedures, I was always concerned about the safety. In my age, you like to sleep well. Yeah. And I remember when I started first procedures, I was always anxious with the morning phone calls from patients. I was always imagining that something wrong happened. So at first, safety, I was concerned, and I was always very thoughtful about optimal results. but I never thought I would go for ultrasound, that ultrasound will play such a big role on our market. But you know, for this safety reason, I joined CMAC on the Facebook. I think I came across this group on Facebook. I joined them and I followed their activities. And some time ago, it was I think the spring, the year before, I came across the advert of Lee Walker on this ultrasound, first ultrasound training, and it was supposed to be held in Costa Rica, the place I always loved to go and never went there.
Oh,
And
right.
it was just after, you know, this COVID time, this lockdown, you know, the opportunity to go to this this place I always dreamt of appeared. So I thought I would have 2 in 1. Facial ultrasound. I didn't know about it nothing. And so I would I would learn new skills, plus going to Costa Rica. And I've seen Lee on the schedule, on the program, and then Sebastian Cotofana with his anatomy classes. So I said, wow, I'll go there. And I went there. So I've met Leonie and Stella Desatnikova for the first time down there. I've never heard about them before. Maybe I shouldn't admit it, but for the first time I've met Leonie down there in Costa Rica. So that's how it started. I started from the scratch.
Good. Viv, over to you.
Just like all of us, Barbara, just like all of us. But it's amazing that you were saying that you started with your background in psychiatry. You've met online Steve Harris. I think you mentioned to me you get on really well with him and you enjoy his view of aesthetics. He's joined us for a live previously.
From the Instagram, I know that he's a CMAC member or the VIP as well, and I came across him last June during the IMCAS in Paris, but I didn't get to know him. But I hope on this CMAC conference we will chat finally, because you know he's like my brother.
Yeah.
You don't meet many psychiatrists.
We'll say hi to
and ultrasound.
we'll say good hi to Steve if he's watching anyway. But one of the things that has brought us together tonight is the interaction between different practitioners around the world. And one of the things you now do, having started your own training, having trained yourself, is your own training in ultrasound. So you do work with Rosa Segrist, who, It was a nice post that you've got on your Instagram, Barbara, about you and Rosa talking about ultrasound. I think it was a funny little post you did a while back.
I think it was the last training. It was the end of June. Yeah, you know, what was very surprising to me about this first facial ultrasound course in Costa Rica, that there were, in the group of 25 people, women, there was no men. Oh, maybe there were 2 guys. There were 20 injectors, so-called injectors, and the rest, a few of us were doctors, mainly dentists, and there were some of us were starting from the scratch, and between us in this little group there was Rosa Segrist. I didn't know what she was doing down there, learning from the basics, starting from the basics. But I think Rosa went there just to get known get friendly with European people and with Stella, because she didn't have chance before to meet Szelkę personally and Stella Desatnikowa. So we got friendly down there. And Rosa is, you know, Rosa, she's very open, she's beautiful person, beautiful doctor, very open, very keen on education. And she proposed me to run some courses in Poland, but of course for a long time I wasn't ready to do so. But after some time, when my colleagues discovered that I do understand some scans, at that time still with the Lumify, they asked me to teach them. So I thought, no, I'm not ready yet. And it made me to ask Rosa to join us and to organize trainings, and she was very open to it. So by the end of June, we organized 6 trainings. There were 4 so-called basics and 2 more advanced for the guys who were admitting the first step and wanted to learn more. Yeah.
Amazing. And the work you now do with the training you provide to practitioners around Poland and perhaps the world as well, what do they think of your training, and how do they feel about implementing ultrasound within their own work, Barbara? How do you think they feel based on your training? Do they feel more confident in using the technology in their own work?
We got many feedback from doctors who attended the trainings that that it was the best training they've ever admitted, but I think it was due to the totally new topic. Everything was so different, so new, that they were quite enthusiastic. Yes, but you know, what I observed when we were organizing the more advanced meetings, there were only a few doctors who were interested in it. So not all of them, they felt, they didn't feel like the ultrasound is their niche. So they consume it, they tried it, and they found out that this is not for them. But this one who caught the bug, they ask us for more trainings, and we have now even some of doctors who were attending to advanced training because they want to learn more and more. Yes, but I'm very pleased because when I observe colleagues who attended the training, I observed their work. Some of them, they work with ultrasound. I have a lady, she's a master on lips, and she started to using Clarius, and she performs nice ultrasound of lips. And when I observe doctors who attended the trainings and they work with ultrasound, I'm very, very happy. The heart grows.
Yeah.
But there are still a few doctors who do so.
It's nice to be able to hear you talk about the work you do with ultrasound. I thought, myself and Sunny, we thought it'd be interesting just to talk about a couple of cases, you know, that you've been involved with during your work using ultrasound. So I've got one of the cases, the first one, involving, this was just one of the shots on your Instagram, an angular artery deep piriform case. And what this involved was an occlusion in one of your patients, I think. I'll go through a couple of the scans. You can talk a bit about this case if you'd like, Barbara. You can describe what happened.
This scan, this is not the scan of the lady, but this is the scan of the angular artery. I wanted to point out to doctors that we should be very careful with doing this so-called gunshot in this area, into the piriform fossa. For many
piriform
years
fossa,
I've been on the market, and I see that, and I was thought that here, this is very safe place, so you just go deeply to the piriform fossa and you would never have any problem. But by now, from the literature, from our experience, we know that in 20% cases, the angular artery is just right in here. So I try to raise awareness of my colleagues that they shouldn't feel so comfortable and they shouldn't do these blind injections even in the piriform fossa. Yes, the lady you were, these are the scans of this lady. The patient you showed with, this is a patient who was referred to me from the, Cosmetic Educational Center. She was a model during the training where beauticians were training other beauticians to do the injections. And and it happened what happened. But before she was referred to me, she visited 2 or 3 other clinics. And when she came to me at this stage, it was the 3rd stage with pustules on her face, and she was really in pain, and she was very depressed. She was crying. She came to me with the, nobody scanned her, of course, and she came to me with the full pack of medicaments. There was everything in this. From all the doctors, she got different antibiotics, she got steroids, oral, she got topical steroids, many other drugs. And she was sent back home. But
just Barbara, up until the point where she came to see you, had anyone tried to dissolve the issue?
Had anyone tried? In my office, she came to me, and when she was in the waiting room, I've already understood what happened, and I took care of her. I knew that I had still some time, so I wasn't scared. So I started scanning her. Quite a long time. It took me a long time, and applying her Hyalase. And I think, and I was doing that with the ultrasound guidance. So, we know from the literature that when you guide the injection with Hyalase, you apply much, much less. But it wasn't true in that case. I applied at least 6,000 units, and I didn't have results.
Okay.
So I organized quickly the teleconference with Rosa, and she was observing what I was doing. She was observing scans, and she encouraged me to put more. So we finally ended up with more than 10,000 of units. Then I found out that this lady was injected with a very fun and very popular among beauticians HA, which is called Revolax. I'm sure you have Revolax on your market because Lee Walker told me about this.
Yes, yeah.
Not very fine HA, and I knew that there is a huge resistance to Hyalase. So that's why I injected so many units. But finally, the lady left the office. She didn't have the clinical symptoms. She was smashed with all these injections, but she was happy. And I referred her to the hyperbaric treatment for 10 courses because of the hypoxia, because of this trauma I did to her. And she came to me after 1 week. She was in a good shape, psychologically, and on the photo you could have seen the face was healing properly. But we are still in touch. She's coming to me every month for the CGF to regenerate the tissue. So she's very grateful because we actually help her to avoid the necrosis, and she was one step to it. Yeah.
Amazing. It's amazing. And you see problems quite often, I suppose, different problems in different patients based on treatments they've had elsewhere. This is a second case, Barbara, involving lips. You can tell us a little bit about this treatment involving a patient's lips. So you,
thanks God, it wasn't the VO. It was another lady
yeah.
who came to us, and she had her upper lip overcorrected so badly. She looked very bizarre, and she was 1 week in front of her wedding. So she asked us to help her, and she came. Of course, she was doing her beautification, so-called, in the cosmetic center. So we scanned her. We found out the lumps, big lumps of HA in her upper lip, and I tried to be very delicate with the injections because I didn't want to get her bruised. So with I think maybe altogether 150 units of Hyalase, we got rid of this, you know, these lumps and these heels on her upper lip.
And did you inject under Barbara? Did you inject under ultrasound guidance?
Yeah.
Brilliant.
But she looks bizarre, you know. She came like
amazing.
Yes, no, we can imagine. We can imagine.
Yeah. It's just I think a lot of practitioners don't realise the sorts of problems that can happen and what to do about them. You know, in an emergency, they get trained to use Hyalase, but how to use it, where exactly to use it, that's one of the biggest problems. Most occlusion treatments in the UK are based on flooding.
Yeah.
You know, completely flood the area with as much Hyalase as you can get. Yeah. But now with ultrasound assessment and guidance, there's much more accurate ways of treating the problem, I think. And Leonie and her colleagues in the Netherlands have provided research to show that guided use of ultrasound is far more effective, particularly with a problem like an occlusion, an adverse event. It's far more effective to treat using ultrasound. That research they've published recently.
But you know what, this patient didn't help us.
Well, looking a little bit into the future, Barbara.
Quality of HA, it is in there. So in this case, we have to use a lot of hyaluronidase. But I remember my first VO, my own one. Yeah. I
yes,
remember
no,
my
hear you.
first VO. It happened to me.
Oh no, we've lost the sound. We've lost your sound, Barbara. Oh no.
Oh, you've just, Barbara.
Can you hear me?
Okay.
Yeah.
Yes.
Now we can.
Now we can. Yeah.
When I came back in Poland, there was no Clarius, so I bought via the.
Oh.
Seem to be losing Barbara again.
Barbara, the sound is the sound is going in and out.
See if it comes back.
No.
It looks like the.
Okay, just a second. I put my headphones back.
Right.
Yeah. I think that's probably what it is.
Yeah.
No.
Hello?
Seem to be missing the sound again, Barbara.
Now we can. Yeah.
Can you hear me?
Yeah.
Yeah. Okay.
That's good. Good. That's great.
First VO,
but yeah,
I didn't have I couldn't scan the patient yet, so I fill her in with all my stock I had in the fridge, but it was, thanks God, it was only 6,000 units at that time. And she left my office with no clinical signs, no pain, and everything was seemed to be okay. And she flew back to Germany. But I had a feeling that there is her nose, her tip of the nose didn't recover properly. So I was quite anxious, and we agreed to meet every day on a WhatsApp for 3 weeks. And I was checking on her. We were checking the CRT, and I was getting more nervous. And she didn't have any complaints, but I looked at her nose and I knew that I could have done better. So I asked her, after 3 weeks, I asked her to fly back to me, to my office. Meantime, I called Leonie and I asked her if she could go to Rotterdam to her clinic, because the lady was from Düsseldorf, so it was only 90 kilometers of driving, and to me it was quite a flight. But the lady decided to come to my office. When she came to me, I had the Lumify on. I placed the Lumify, but I couldn't see any HA deposits with it completely. So I called up Leonie. I was lucky. She was driving a car, but she helped me to find some little deposits, and I placed 75 units of Hyalase, and everything recovered. So it was magic, you know?
Wow. So Leonie was able to see a very small amount of HA deposit from your imaging. Wow, amazing.
I was showing her the scan, bad quality of scan via the WhatsApp, and she said, "Here, Barbara, here, put here." Yeah.
Amazing. Amazing.
It is amazing. Well, I just wondered, Barbara, about the future of ultrasound. What do you think lies ahead for practitioners? Do you think ultrasound is going to be a good benefit for practitioners to use? How do you see the future?
A couple of years, all of us, all of our colleagues, we will have this portable device. I just wish the quality of picture was better and was colored like your scans to better understand this.
Well, I was going to come on to the fact that you're going to be presenting at a conference in Poland, one of the first aesthetic conferences in Poland, you looking at ultrasound. And I've sent you some scans, some CGI scans, which you can use for the presentation.
Presentations, yeah. We have many conferences, but they weren't dedicated to ultrasound yet. So we, on this conference in December in Zakopane, we will have the session dedicated just to ultrasound. And there will be Rosa speaking on online, Dr. Roberta Vasconcelos from Switzerland. Me, I will be leading the session, and there will be one guy who is the physics. He will be talking on physics of ultrasound. So I'll present them your beautiful pictures.
Thank you. Thank you. It's nice to be able to speak to practitioners like yourself who try to improve, the way this can help others around the world. So thanks a lot for that. I was talking to Sunny. We're going to be both at CMAC in November in a couple of weeks' time, 2 weeks from now. Will you be there, Barbara?
I'll be there,
Oh, brilliant. Brilliant.
I'm sure it will be a great meeting. All this deeps of ultrasound will be there.
One question I had for you, Barbara, and we've got a lot of practitioners watching us, so I would have to capitalize on the fact of your psychiatry background, a little bit of what you mentioned, and aesthetics. Okay, so you are a qualified psychiatrist, yet you still suffer, well, I wouldn't say suffer, but you still experience, you know, when you started out with anxiety related to doing aesthetic medicine. For those practitioners,
of course.
yeah, you mentioned when you first started out. So as a psychiatrist, there's a lot of practitioners watching. What has helped you to improve any feelings of anxiety? What advice would you give to any of the practitioners watching that, you know, get anxious about doing dermal fillers? You know, they might be very good at it, but what has helped you then, especially from your psychiatry background?
Practice, trainings, education, following the literature, cadavers, and finally ultrasound. So only practice and development and education. Okay. There is no other way to get rid of being anxious after the procedure. So you need to learn, you need to develop.
Perfect. Brilliant. Thank you so much. I'm sure a lot of the practitioners watching will really appreciate that, especially if you're watching it back. But thank you. Viv, I think we've gone over time slightly because it's been interesting talking to Barbara. So do you want to wrap up for us?
It's been really nice speaking to you, Barbara. Thanks a lot for joining us this evening, and we're looking forward to seeing you in London in 2 weeks' time. Just to talk about next week, we've got a practitioner who's again another member of CMAC, Dr. Patricia Barrera, who's based in Argentina. She had a case involving dermal filler lip treatment some weeks ago, and she had only just learned to use ultrasound. And she was in contact with Carolina Mariluis, who's a radiologist in Brazil, and the two of them managed to assess a patient remotely who had a potential occlusion. So we're going to talk to her about the case involving lip filler. So that's next Thursday, 8:30, and we'll hopefully have a good chat with her, myself and Sunny. But really, just to round off, we think it's really nice again speaking to you, Barbara. We're looking forward to speaking to you in London in a couple of weeks. Is there any final comments or anything you wanted to say to anyone who might be thinking about ultrasound, but really still is a bit dubious about how well it would help them? What have you got to say to somebody like that?
Thanks to picking up on ultrasound, I finally understand anatomy and I really learn anatomy. You know, I've been to 5 cadavers workshop all over Europe, and I think thanks to facial ultrasound, I understand the biomechanics and the dynamics and 3D what's going on the face. So they need to be more. They need to understand better anatomy, and the ultrasound is the best way to it, and affordable way with the portable ultrasound. Yeah, because we cannot have all MRI in our offices, huh? But we can all have the facial ultrasound, the portable device.
Not yet.
So go.
Not yet.
Yeah.
Yeah. Thank you very much. Thank you very much for all your wisdom and all your knowledge that you've shared with us this evening. We'll be back next Thursday, 8:30, and we look forward to speaking to you in London, and we'll do a live, hopefully, when we're there with yourself and maybe other specialists as well. But until then, we'll say goodbye, and thanks for everyone for joining us this evening. So thank you, Barbara.
Thank you, Barbara. Good night. Lovely to meet you.